Welcome to the Belly Brain Connection. I'm Hannah Winans. I'm a certified functional nutrition counselor, and I'm on a mission to help educate people about the connection between their gut health and mental well-being. I believe that our gut health is the cornerstone to our overall health, and when we nourish our bodies, we nourish our minds. Belly Brain is for informational purposes only. I'm not offering medical advice here. If you need medical advice, please consult your physician. Thanks for tuning back in. Today is episode 23. This one took me a while to get to you. My husband and I were sick for about a week. And so I kind of had lost my voice and it was a whole thing. So glad to be back, feeling better. And I appreciate you for tuning in. So for today, it is part 3 of our 3-part series, Gut Disruptors. Last week, we talked a little bit about sugar and how sugar can impact your gut health and just some ways to be careful with it and things to look out for in your diet. Specifically, I went over fake sugars. What are we calling those? I'm sorry, I'm having a brain blank, but artificial sweeteners. That's the word I'm looking for, and how those can disrupt your gut. So for today, we're going to tackle alcohol and NSAIDs. And I've talked a little bit about NSAIDs in the past, but I wanted to tie it back into this Gut Disruptor series. And alcohol, I know, can be kind of a touchy subject. A lot of us enjoy a cocktail or a beer or wine or whatever it is that you like. And so I don't want this to be about anybody feeling guilty for drinking or saying that you can't drink at all or have alcohol in your life. It's more about, again, like all things belly brain, just kind of creating that awareness of how it affects your gut health. So if you're working on your gut health and really trying to improve that, you want to be aware of what you're drinking and how it could be impacting you. So anyways, we'll talk a little bit about that. And then food of the week, honey. Honey is the food of the week this week because when we were sick, we had really sore throats and we were using honey in our echinacea tea. And I just kind of started thinking about what is it about honey that is helpful, because it is pretty soothing and it does work. And it's not just an old wives' tale. So I thought that would be a fun one to incorporate for the food of the week. And also it kind of ties back to sweeteners and sugar that we covered last week. So to dive right into our digestive health and alcohol, I'm going to just read to you a little bit of information that I found. And this was from a website called Digestive Health and the gastroenterologist. I always have a hard time with that word, who I did a little bit of a write-up. His name is Tanver Haig, Dr. Tanver Haig. And I'm going to kind of read this to you and then expand on it. So this is what he has to say. For most people, moderate consumption of alcohol is pretty safe and is not likely to cause problems in your gut. Moderate consumption means no more than 1 drink a day for women or no more than 2 drinks a day for men. But when your consumption gets to be more than 1 or 2 drinks a day, then you're likely to have gut problems. And it's interesting because I've noticed with people who have skin issues, eczema, rosacea, which we've talked about in previous episodes, that a lot of that can be tied to your gut health. I've noticed that some people, when they've stopped drinking, are really limiting their alcohol. If it's something that they're doing regularly, we see those skin issues improve. And before I really got into all things belly brain, I thought maybe it was just a direct alcohol skin related issue. But now I'm starting to realize that I think this actually has more to do with the gut. And it's overall inflammation anyways, but I'm thinking, well, if alcohol really impacts your gut and your gut has, an effect on your skin, then all of that could be tied together. And that could make sense why when people quit alcohol, why so many things kind of clear up. So here are I'm going to go back to my notes. Here are some of the potential problems that alcohol can create. Acid reflux. So drinking alcohol relaxes the lower esophageal sphincter, which normally presents acid in your stomach from backing up into your esophagus. The sphincter doesn't work well when it has been relaxed by alcohol, so you're more likely to experience acid reflux, commonly called heartburn, after drinking. And I've seen this a lot in people that I know. And I'm not a person that's ever had a lot of heartburn. Thankfully, the one time I got it really bad, the first time I got it, I thought I was having a heart attack. I had no idea how painful heartburn is. I was telling my husband, I was like, I think you need to take me to the hospital. My chest is on fire. I don't know what's going on. And he was kind of laughing at me. He's like, you have heartburn. I was like, this is what heartburn is? Oh my God, this is awful. And I know that people experience this a lot. So definitely have more sympathy for when people are having acid reflux and heartburn. And, the research that I've done for all things gut health related, a lot of those, I think they're called pro pump inhibitors, but those pills and that you take for heartburn, a lot of those cause a lot of issues themselves. So looking at, and well, maybe we'll do a whole episode on this, on heartburn and some ways that you can treat your heartburn with your diet versus going straight to medications. But anyways, so acid reflux, heartburn, that is something that is really disruptive to your gut health, super uncomfortable. And then also it's something that alcohol can trigger. Okay. So it says here, almost everyone experiences occasional acid reflux, and for most people, it's not a serious problem, Dr. Haig says. But for people who frequently drink too much, acid reflux can become a chronic and serious problem. Over time, repeated acid reflux can lead to more serious conditions such as Barrett's esophagus or esophageal cancer. In some cases, people may need surgery. Okay, so that feels a little bit extreme, but again, I'm kind of just reading you these notes and I'm trying to get this information out to you clearly. So definitely, if you're experienced a lot of acid reflux and you're drinking, those two things could be connected, and maybe you need to be a little more careful. Diarrhea. Ugh. Everyone has a mix of good and bad bacteria in their gut. Drinking too much alcohol disrupts the normal balance, increasing the bacteria that causes inflammation and irritation in the gut while decreasing the bacteria that aid in digestion. Excessive bad bacteria can lead to leaky gut, in which gaps in the intestinal wall allow bacteria and other toxins into the bloodstream. So, we have talked a lot about leaky gut in previous episodes, and I think that is a condition that is affecting way more people than we really realize. And a lot of the inflammation that's in our bodies, I think, is being caused by the things that are slipping through our mucosal lining and getting through our guts. And so it was interesting to see that this is also correlated to alcohol. Let's see, it goes back to explain leaky gut. I tell patients to think of their intestinal lining as a brick wall. When there are cracks in the mortar between the bricks, water can leak through. In leaky gut, alcohol causes cracks in the mortar of the intestinal wall. Excessive alcohol consumption leads to leaky gut, decreases gut absorption, and increases the production of bile in the liver, all of which can lead to diarrhea. Okay, so diarrhea, not good. Well, I mean, we know that, but again, can be correlated to alcohol. Gastritis. So number 3 that he's got on this list, gastritis. Drinking too much alcohol disrupts the production of mucus that lines the stomach. And we've talked a lot about mucus in these podcasts, which can cause the stomach lining to become inflamed. This condition is called gastritis. Symptoms of gastritis include abdominal pain, nausea, and vomiting. Repeated episodes of gastritis can lead to more serious conditions such as ulcers, anemia, or stomach cancer. Okay, so there's a few more things here. I don't want to get too much in the weeds, but basically we're making that connection that alcohol can really create some gut dysbiosis. When we have gut dysbiosis in our guts, then that can lead to inflammation in our bodies, and that can cause a whole host of other problems. So, limiting alcohol, being careful of the alcohol that you drink, trying to make better choices. I think that can be really, really important in your overall gut health and just how you feel. I mean, I think we all know that alcohol is not good for us. There's been studies that have talked about, red wine being okay, and, the polyphenols in the red wine. And I don't know that I buy that. But everybody's got their thing that they love. So I think that if you are somebody who drinks on the regular, then just kind of being aware that you may need to do some additional things to protect your gut health. And you can do that by eating, foods that are rich in prebiotic and fiber and probiotics, and really getting those fermented foods in can be really helpful. And just being careful with how often you're drinking. And if you're noticing, if you've got a lot of issues, like maybe you've got some skin issues and gut issues, and you kind of feel like everything's out of whack. If alcohol is a regular part of your diet, then maybe you really need to look closely at that, because that could be the cause of a lot of what you're going through. And you probably know it, right? Subconsciously, or just kind of even in the back of our minds, we know that this can't be great for us. But if you're really trying to do some damage control or some repair work in your whole body system, then restricting, limiting alcohol, that could be the key to really clearing up a lot of things. Another thing that they go over, bloating. Alcohol consumption disrupts both the digestion of sugars and the balance of bacteria in the gut. So again, we're coming back to bacteria. It also leads to a shift in the gut's normal fungal diversity, causing an overgrowth of a type of yeast called Candida. This shifts increased gas production in the gut, and that causes your abdomen to feel uncomfortably bloated. Okay, I'm not a big drinker. I drink kind of socially. It's not something that I do every day, but I did go through a battle of Candida, and I mentioned this in previous episodes. And that's exactly what Candida feels like. It's a bloating issue that you're really reactive. Like every time you eat something, you just feel like you're going to explode. And that sounds really graphic. I don't know. It feels like you're going to pop. That might be a better word, but it's definitely really uncomfortable. And if you're consuming a lot of alcohol, people talk about the beer belly. I think a lot of that is gut dysbiosis, and it's bloating in the gut caused by the imbalance of bacteria that is happening from the alcohol. So yeah, alcohol, not great for our bellies. Be careful with it and just be aware. Make good choices when you can. Protect your gut when you can. I'm going to move on to NSAIDs. Gosh, you guys, I have the hardest time with that word. I don't know what the deal is. NSAIDs. NSAIDs. So those are painkillers. Those are things like ibuprofen. Where's my little list here? Naproxen, aspirin, some of the heavy duty painkillers that we get, prescribed when we've had surgery. Those can be, if they're non-opiate, that's an NSAID. So I think like I've been prescribed like a really high dose of not Tylenol, maybe it was Tylenol, but there's certain really intense versions of these over-the-counter medications that we can get. And those can really be gut disruptors, and also opioids, because a lot of those can cause constipation. They slow down our gut motility. So if you've been on opioids for a while, then you could have some gut dysbiosis going on as well. But the reason why they can be a problem, and I'm going to read this to you. This is Aging and Cost of Aging. This is a Dr. John LaPuma, a doctor that I found online that I thought had the best information that I'd found about NSAIDs and kind of match what I already know. He says, by design, NSAIDs block inflammatory proteins that lead to pain, but they also can inhibit the production of prostaglandins, fatty acids that help form the mucosal lining of your gut. When this lining is damaged, you're more prone to developing GI issues. And so that's kind of just a quick, easy way to describe what's going on in your gut when you're taking these over-the-counter medicines. So I'm always pretty careful, when I've got a toothache or whatever it is I'm dealing with. I used to just go straight to ibuprofen because I thought it was harmless, right? Now that I know a little bit more about my gut health and how it affects my gut health, I'm really careful with those. In fact, we were when we were sick, we just had this really bad cold, sore throat. It was really hard to breathe, really hard to sleep at night, pretty bad cough. Could have been COVID. We didn't test for it, but it felt very COVID-y. But we had some nighttime medication, and there was one night where I was like, I really need to get sleep, but I don't really want to take this medicine because I don't want to, I know these things can be pretty intense. And I was like weighing that, right? Like, okay, well, I need sleep to get better, but I also don't want to disrupt my gut health. And, it's something I'm always thinking of. So I just decided, I said, I'm going to take half the dose. I don't need to take the full dose. I took half the dose, and cleared me up enough to where I could sleep, because that was part of the problem, is you just couldn't breathe with this cold. And the next morning I felt a little bit woozy from it because those nighttime medicines are really strong, but I felt like, okay, well, that was a good compromise, right? So again, like with all things belly brain, it's just creating that awareness to where you stop and think a minute about how things are affecting your gut. And then you can make those decisions on, do I really need to take the whole dose? Do I just need enough to help me so I can breathe a little bit better? Or do I need it to knock me out so I can sleep? And so I'm constantly looking for that balance. And even with things like alcohol, right? It's that balance of, yeah, I want to have a cocktail. I want to go out with my friends, but do I need to, get wasted? And, I have things to do tomorrow, right? So, can I make some smart choices and just kind of do things in moderation? So I was kind of proud of myself with the nighttime medicine, because I knew, I'm like, oh, I could take this whole thing and it will just knock me out and I'll be out. But I wanted to be careful with that. And I came up with a good compromise. So just little things like that. So with NSAIDs, I just think, when a lot of times I've had a lot of dental work done over the years. And so the first thing they do is they prescribe to you an antibiotic and then, ibuprofen as needed so many times a day. Well, that's huge gut disruption in those two things. So not to say that you wouldn't want to follow your doctor's advice and take those things, but really looking at it like, do I need all that? Um, I've had a couple procedures done where I'm like, hey, do I need to take an antibiotic for this? If I don't need to, I don't want to. And what are the risks? And, can I get away with not taking a ton of ibuprofen for the pain? Can I kind of get through it, and just, kind of gut through it, no pun intended, without really having to take a bunch of stuff. So, and I'm not saying we need to suffer, but I think we've all become very used to just taking a pill to make us comfortable, making something go away. And, we're kind of not letting our bodies in some cases do what they need to do. But again, always follow your doctor's advice, but it's okay to question it a little bit. Okay. So NSAIDs, alcohol, some of the things that a lot of us we're ingesting, and there's not necessarily anything wrong with that. It's just, knowing what that's doing to your gut health, I think is really helpful if you're trying to improve your gut health. Okay, so let's see, I'm going to go through honey. All right, food of the week, honey. Now, I usually I try and find a honey that's locally sourced, and because I was sick and out for a while, I didn't do that necessarily, but I do know, or what I've heard over the years, is that it's really good to find honey local to your area, and then a lot of times that can help with allergies. I haven't researched that enough to bring it fully to you, but I do know that's kind of an old wives' tale, is that if you suffer from like seasonal allergies and you can find local honey, that can really help if you just incorporate into your diet a little bit. Now, honey in the body acts the same way as sugar does. So, just because it's natural, unprocessed necessarily, or processed by nature, I guess, because the bees kind of have to process it all, doesn't mean that you can have a ton of it. And if you are somebody who is needing to watch your blood sugar levels, honey's going to spike your blood sugar level just like all the other sugars. But the nice thing about it is it does have some polyphenols in it, and it's got some antimicrobial properties to it that can make it a really good choice if you want to kind of level up what you're doing with your sugar. And one of the things I'll go over a few of the things that is great about honey. So let's see, I'm going back to my notes. Okay, honey. Honey is rich in antioxidants. So minimally processed honey contains many important bioactive plant compounds and antioxidants, such as flavonoids, phenolic acids, and the darker varieties tend to offer more antioxidants than the lighter varieties. Antioxidants can help neutralize reactive oxygen species in your body, which can build up in cells and cause damage. This damage can contribute to conditions like premature aging, type 2 diabetes, and heart disease. As such, many of honey's health benefits are attributed to its antioxidant content. They can be better for blood sugar levels than regular sugar. So this it might offer a little bit of benefit over regular sugar, but they're saying the antioxidants might help protect against metabolic syndrome and type 2 diabetes. I'd still be really careful with honey if you're watching your carbs and you're watching your blood sugar levels. But I think that it is a better alternative of course, it's a better alternative than white processed sugar. They're saying that it could prevent heart disease. It may help to lower blood pressure, improve blood fat levels, regulate your heartbeat, and prevent the death of healthy cells, all factors that can improve your heart function and health. Additionally, raw honey typically contains propolis, a resin that bees produce from sap-producing trees and similar plants. Propolis may improve cholesterol and triglyceride levels. So they even say here in this write-up that there needs to be more research to understand honey's effects on the heart health better. But that's interesting to me. It also can promote burn and wound healing. There is historical precedent for the use of topical honey treatment for wound and burn healing. This practice is still common today after surgery. Manuka honey specifically, it's really pricey, but it can be really helpful and burns especially. So Of course, if you have a severe burn injury, it's not something you want to treat yourself, but just those little burns like that happen in the kitchen, a little manuka honey on those can be kind of therapeutic. I think it's because it's got the antibacterial property to it and also has some anti-inflammatory effects. Let's see. They also say it can help with related foot ulcers. I hadn't heard that one before. Gosh, that sounds gnarly. But I know that people get them. I know that that's got to be really painful. But interesting to hear that they have been using it for that, because it's basically they're saying it can be an effective treatment plan for burns and wounds. And so that sounds like an ulcer sounds very much like a wound. Okay, so here's where it really helped with our cold that we had, and it could really help children. It says it may help suppress coughing in children. Coughing is a common problem for children, well, and adults with upper respiratory infections. And of course, those affect the quality of sleep. So, one review of several studies on honey and cough in children found that honey appears to be more effective than diphenhydramine for cough symptoms. It may also help reduce cough duration. Another review noted that it may also help improve sleep quality among children with coughs as well as their parents. Further, unlike some cough medicines, honey doesn't have any side effects. Yeah, those cough medicines those are intense. I mean, I think, like NyQuil and some of those things that we take at night to help us sleep. I don't know, for me, I mean, I take a NyQuil and I feel like not only does it knock me out, but it takes me 2 days to recover. I don't know if anybody else feels that way. So if there was a way to avoid having to put our children on those cough syrups and maybe try treating them with a little bit of honey first, that would be a good option. They do say, though, you want to be careful with the honey for children under the age of 1 due to the risk of botulism. So I haven't done any research on that, but if it says to watch children under age of 1, then I would do that. We don't want to mess with our little babies. Let's see. It's easy to add to your diet. So yeah, you can, use honey where you typically would use sugar. I really like honey in yogurt. So that's really feels like a yummy treat. Okay, let's see what else. Polyphenols. It's full of polyphenols, which can help aid in digestion and has other health benefits. I know we're always hearing about polyphenols. The bottom line, honey offers several potential health benefits thanks to the beneficial compounds it contains, such as antioxidants and propolis. It's a great alternative to sugar, but only consume it in moderation as it still behaves like sugar in your body. So a little bit about honey. I'm trying to think of other ways. So honey and just some lemon tea is great. I think we all probably know this is great for a cold and a cough. Like I said, I love my honey on yogurt. There's some really decadent desserts out there, baklava or baklava. I'm not exactly sure the correct way to pronounce that, but that's something that is a treat that we love around Christmas time. And that's got a lot of honey. It's made with honey and pistachios. So yeah, I think that if you're looking to have something sweet, reach for the honey versus the sugar, the straight, white sugar, but just be careful with it. Everything in moderation. And I think that's it. I think for next week, we are going to go over, we're going to kind of book review the book, The Gut Brain Paradox, that I was super excited about. And I talked a little bit about it last week. It's written by Dr. Stephen Gundry and has some really great information in it. So thanks for tuning in. Have a great week. Take care of yourselves. I hope this helps. Bye.